Nigeria's Health Minister osagie Enahire says all contacts of the index case of COVID-19 in the country have completed their follow-up period and have been certified free to rejoin the society. The minister said the index case, an Italian, is making progress and will soon be released from the isolation center at the Infectious Diseases Hospital in Yaba, Lagos. The minister said this while briefing newsmen in Abuja this Friday, where he gave an update on government's effort aimed at checking the spread of COVID-19 in the country. Clearview TV's Rejoin was there and now reports.
As the Minister of Health, osagie Enahire, explains, Nigeria, as at 13th of March 2020, has recorded still just 2 confirmed cases of COVID-19. One case is now negative and will be discharged from care, while other will follow in few days. He also said that between 7th of January and 12th March 2020, a total of 42 people who met the Italian have been screened for COVID-19 in 6 states, namely Edo, Lagos, Ogun, Yobe, Rivers, and Kano, as well as FCT. Out of this number, 40 tested negative and 2 were confirmed positive. The index case and the contact of index case with no deaths recorded.
The index case is clinically stable and is much improved. Steady progress till early next week will guide the medical team in discharging him. The second confirmed case, a contact of the index case, is testing negative for the virus now, meaning he has cleared the virus and will be allowed to go home. A group of 4 children and their teacher flew into Lagos from the United States, but prior to their arrival, Nigeria CDC was informed by US CDC that this group had been in the same space with a confirmed case of COVID-19. We therefore sent these travelers into isolation on their arrival, and tests were done, which came back negative for all of them.
The minister noted that incoming travelers are still under close monitoring and that the ministry will select those that fit case definition for secondary screening. He added that following the World Health Organization's declaration for coronavirus as pandemic due to the increased spread in some countries, the health minister has begun a review of the case definition.
Following declaration of a pandemic and increasing spread in some countries, we have begun a review of our own case definition. However, Nigeria has not placed a travel ban on any country passport or flights. They will still stay in self-isolation for 14 days. As of today, 13th of March 2020, Nigeria has recorded still just 2 confirmed cases of COVID-19 with no deaths. 1 case is now negative and will be discharged from care, while the other will follow in a few days. After 14 days of follow-up with no symptoms, all contacts of the index case, both in Ogun State and Lagos State, will be allowed to go home and rejoin society. The multi-sectoral EOC, Emergency Operations Center, continues to oversee national response activities. We have progressed in assessing treatment centers and have now ensured that every state of the Federation, particularly those with international airports, identify a location that can be used to manage cases. We are supporting these states to scale up capacity to meet existing needs.
Meanwhile, the National Center for Disease Control (NCDC) has launched a new website focused solely on COVID-19. It is updated daily and has information needed, including daily situation reports, guidance for schools, guidelines for health workers, and more. The website is covid19.ncdc.gov.ng. The minister also advised citizens not to engage in lengthy self-medication and not to mingle with people or to congregate, but instead stay at home if they feel unwell, and also not to fail to contact the SCDC toll-free number, which is 080097 00000, which is available 24/7 for guidance. Rejoin, reporting for Clearview Television.